We'll next hear from Dr. Georges Benjamin. Dr. Benjamin is a national leader in public health and safety. He is executive director of the American Public Health Association, which is the largest and oldest organization representing public health practitioners in the country. He is also a former Secretary of Health for the state of Maryland and an emergency physician. Nobody brings to this issue more real-world experience dealing with the devastation and destruction of big truck crashes on families and our medical system than Dr. Benjamin. Thank you so much.
Well, good morning. APHA is a nonpartisan national public health association. We champion the health of all people in all communities through education, research, and advocacy. Coincidentally, this is National Public Health Week. National Public Health Week is the week in which we sit around and celebrate prevention and wellness. And I can tell you that throughout my career, we've certainly been concerned about many of the problems plaguing our nation's roads. Now, highway crashes are an excellent example of a serious and costly public health problem that can be mitigated by prevention. In particular, deaths and injuries caused by large trucks are a major contributor to the serious and costly public health problem. In 2012, over 3,500 people were killed and more than 100,000 people were injured in crashes involving large trucks here in the United States. And this number has been steadily on the rise. From 2009 to 2012, the number of people killed in truck crashes has gone up by 16%, and the number injured has increased by 40%. The annual cost of society from crashes involved in commercial motor vehicles is estimated to be over $83 billion. Truck crashes are also an occupational hazard. Truck drivers have one of the highest rates of injury and illnesses of all occupations. Unfortunately, truck driver deaths are also on the rise. Now, the disparity in the size and weight of trucks and cars has deadly consequences. In fatal two-vehicle crashes between a large truck and a passenger motor vehicle, guess who loses? 98% of the fatalities are occupants of the passenger vehicle. Not surprising. The bigger the truck, the bigger the problem. 74% of those killed in large truck crashes in 2012 died in crashes involving tractor trailers. The public health community recognizes that moving goods by truck is absolutely an essential part of our nation's freight transportation system, so we should continue doing that. However, the economic and emotional toll of truck crashes is unnecessary and unacceptable. Compared to other modes of freight transportation, the mortality and morbidity toll is staggering. Truck transportation is responsible for 3 out of 4 freight transportation-related fatalities and 9 of 10 injuries. The tragic and life-altering consequences of large truck crashes are predictable, perilous, and preventable. Let me repeat that. They're predictable, perilous, and preventable. We can and must do more to protect truck drivers and the traveling public. Allowing trucks to become heavier and bigger is really clearly not the answer if we're trying to reduce crashes, death, and injuries. I'm here today to lend my support to efforts by members of Congress, truck crash victims, survivors, truck drivers, law enforcement, and our academic community to prevent truck crashes and oppose changes in federal law that lead to more deaths and injuries. Thank you very much.